Thank you very much, Mr. Chairman. Repeatedly, President Trump has complained about the cost of drugs, especially with regard to Medicare. He has told us, quote, they don't bid them out. They say like $300 billion could be saved if we bid them out. We don't do it. Why? Because of the drug companies. And after his big Rose Garden speech last Friday, I've been trying to find a rose-tinted set of glasses thick enough to be able to find anything in his blueprint that would stop the very kind of prescription drug price gouging that he denounced that afternoon and has done so regularly in the past. With prescription drug prices rising at 10 times the rate of inflation, American consumers need deeds, not tweets. Even in the face of this opioid epidemic, a devastating national public health emergency, pharmaceutical companies have taken advantage of the situation in an incredible way. In early 2017, Kaleo Pharmaceuticals spiked the price of its auto-injector, Avizio, from $575 to $4,500, a 682% increase. Amphastar, the manufacturer for a generic nasal spray, spiked the price by 95% in 2014. Hospira, one of the leading manufacturers for injectable naloxone, spiked prices by 129% over a 4-year period. All of these price hikes were happening at the very same time that opioid overdose deaths were rising dramatically. Just as President Trump has promised to rein in this kind of price gouging, he's also promised to resolve the opioid epidemic, and yet none of his proposals have included a call to bring down the price of naloxone. Pharmaceutical companies continue to have unchecked power to raise the price of their drugs. In a rare public health advisory from the U.S. Surgeon General, the public is now being called upon to carry naloxone with them, but it's impossible to do that when the drugs are unaffordable. Among those who are most directly impacted by this incredible amount of price gouging that is occurring with naloxone are the police departments and the fire departments across the country that are being asked to stock it to deal with the potential for overdose deaths. One community after another has been seeking relief in this regard. Just run through a few headlines. One, how does a $575 life-saving drug jump to $4,500? Blame a perverse system. The New England Journal of Medicine, the rising price of naloxone risk efforts to stem overdose deaths. Scientific American, massive price hike for life-saving opioid overdose antidote. Narcan prices are skyrocketing and cities are begging for help to buy it, says another. National Public Radio, first responders spending more on overdose reversal drug. ABC News Radio, health workers ration opioid overdose antidote amid price hikes. There is something we can do about this. This amendment is very direct. While I would like to see us address the broader question of negotiation to reduce prices and achieve the $300 billion savings that President Trump once urged that we do, this amendment is narrowly focused, and it simply directs the administration to negotiate the prices on naloxone so that our police departments and our fire departments are not overburdened, and so that consumers are not overburdened by those who engage in price gouging. And I would move adoption of the amendment. I think it would be a really constructive measure to help local government, to help consumers, and to deal with an issue that is central to this opioid abuse problem, and that is how do we prevent deaths from overdoses before we begin the treatment that is so desperately needed to address this crisis. So I move adoption of the amendment and urge my colleagues to join in supporting it.